Found after World War II in 1948, the Geneva-based organization is a specialized agency of the United Nations with a broad mandate to act as a coordinating authority on international health issues. It is led by a Director General, presently Dr. Tedros Adhanom, who was elected to a 5-year term beginning July 2017. The World Health Assembly, comprised of representatives from the WHO's 194 member states, is the supreme decision-making body for the agency and convenes annually. So how does the World Health Organization work? The World Health Assembly is responsible for selecting the Director General, setting priorities, and approving the WHO's budget and activities. Every 6 years, it negotiates and approves a work plan for the World Health Organization, and every 2 years, it approves the budget. Where does the World Health Organization receive the funding from? The WHO has two primary sources of revenue: assessed contributions, which are set amounts expected to be paid by member state governments, scaled by their income and population. And second, voluntary contributions, which are other funds provided by member states, plus contributions from private organizations and individuals. In 2019, the United States contributed about $553 million. The US contribution is nearly twice the next largest contribution from a nation, the United Kingdom, which funds 7.79% of the WHO budget. The Bill and Melinda Gates Foundation pays for 9.76% of the budget. So what puts the WHO in the limelight? In April, the White House announced that it would be suspending financial support for the WHO based on a review of the organization's activities related to the COVID-19 pandemic, with President Trump stating that US contributes between $400 million to $500 million per year to the World Health Organization. President Trump has accused the WHO of responding sluggishly to the threat of the virus and not being critical enough of the China. The World Health Organization had consistently advised against travel restrictions, arguing that they are ineffective, can block needed resources, and are likely to cause economic harm. Some experts have said that the WHO was slow to declare a public health emergency and was too trusting of the Chinese government, which initially tried to conceal the extent of the outbreak as the country has gained influence in the organization. Mr. Trump's decision to halt funding appears to be the first such formal announcement of its kind by an American president. Nikki Haley also noted that Taiwan had warned the World Health Organization of human-to-human transmission, but it was summarily ignored due to China's influence. Dr. Tedros has also been accused of covering up epidemics in his home country, Ethiopia, while he was the health minister in the government. So, how does it all affect us? This is not the first time the World Health Organization has come under scrutiny. Critics saw fault in its response to the 2014 West African Ebola virus epidemic. Yet the containment of infectious disease outbreaks wouldn't be possible without the type of cooperative mechanisms carried out by the World Health Organization. Keeping the fast globalizing nature of our world in mind, the role of international organizations is increasingly becoming more important in forging better conversations between governments.